Hello, wherever you're tuning in from. This is the Investors Corner, where we explore hidden treasures. With me, Tech Stephen Good. In this episode today, I'm glad to be joined by the Undersecretary of the Ministry of Health, Dr. Victoria Anip Majur. Welcome to the program.
Thank you, Tech, and thank you for the opportunity to be interviewed at the Investors Corners program.
Thank you. Yes, in this episode today, we are going to talk basically about the positive development in the health sector and the latest activities that the ministry has conducted. We have seen you lately engaging in many activities, and we are going to begin with the first one, which is the inauguration of the Gudele General Hospital. Briefly, maybe if you can tell us about this. We understand it is partly or fully funded by the Emiratis. Maybe you can shed more light on that. And what is the importance of launching that kind of a facility at that place at this time?
Well, the Gudele General Hospital is a 60-bed hospital donated by the government of UAE to the government of South Sudan and built by the Abu Dhabi Fund for Development. It is well equipped and state-of-the-art facility with good consultation clinics, specialized clinics of dentistry, gynecology, general medicine, pediatrics, and even it has a ear, nose and throat clinic. It also has a ICU with 5 beds and an isolation center. It has imaging facility with CT scan and CT angiogram and all other modern equipments. It has a well-equipped laboratory with a blood bank. It has doctor's resting lounge with a cafe for the residents and for co-patients. It has a provision for medical gases, so it's well structured and really well equipped, like any other facility at world standard. And the importance of this facility at the particular time is it will boost the health service delivery to the people of South Sudan. It is based in Gudele, and Gudele is densely populated, one of the most populated areas of South Sudan, and particularly Central Equatoria, and it will be a flagship program to the Ministry of Health, and the Ministry of Health is trying its best to utilize that opportunity to domesticate treatment in the country. We are spending a lot of money to go abroad for simple things that can be managed here locally. We have a lot of ladies going abroad for deliveries, going to neighboring countries just to have a baby. Imagine having that kind of facility will minimize the out-of-pocket expenditure and the money taken outside the country, and it's going to be invested here in South Sudan.
And this hospital, is it a public hospital or is going to operate as a private?
It is a government facility. It's a gift to the government of South Sudan. However, the Ministry of Health is trying to set up a model that will sustain the facility. We have learned from experiences of the modernization of Juba Teaching Hospital being a fully government facility and how it ended up currently being deteriorating. We have also Kirmayadi Women Hospital in Rumbek, built by the Chinese government, fully equipped with a very nice facility for doctors' quarter. However, it's underutilized because of the running cost and because of the funding to the hospital. We have Al Cardinal, which is also deteriorating because of the lack of funding and lack of support to the hospital, especially the current budget of which is quite little to the health sector, barely covering salaries and operation. So we are thinking about having a model, perhaps a public-private partnership, so that the hospital is maintained and sustained. Otherwise, sustainability could be an issue. Also, with the current brain drain of doctors moving to private facilities and moving to the NGO world, we don't want to end up having a facility where we're not paying doctors well. And we're thinking about having a public-private partnership simply because we would like to have an income to the hospital, to run the hospital, to pay the staff, and make sure that the staff are kept and motivated. Otherwise, you cannot run such kind of big facility with unmotivated staff.
Yes, and Dr. Victoria, maintenance is going to be one issue for the public, as you mentioned, the running cost and all this. We have also seen recently the launching of a building in Juba Teaching Hospital, the Chinese-funded maternity ward. Maintaining this state-of-the-art is the major problem, because if you don't maintain it, it becomes useless. So what is the strategies now that the ministry and the hospitals are going to put in place to ensure that these facilities remain the same? Like
I said, the Juba Teaching Hospital is a public facility. It's a public hospital, and after modernization, we were receiving a lot of people, especially maternity wing. Currently, a lot of women are coming to deliver there. unlike the past where people were discussed coming to Juba Teaching Hospital, because it's well equipped, it has good facilities, it has private rooms, and the hospital was obliged to do a cost recovery or a cost sharing. And despite that, the public is still complaining. But how do we expect such a facility, especially maternity, to be run with no cost? Because you need a clean facility. Maternity needs to be maintained. It has to be clean. The staff has to be motivated. It works 24 hours. And motivation of staff is one big challenge we're having in the Ministry of Health. I think you have heard about the strikes and doctors going on strike because of no pay. And our salary is delayed. There's always a delay of salary of civil servants. It is low and it is delayed. So I think learning from those mistakes, the Ministry of Health is trying to change the status quo, especially with this current new hospital, to put in place a public-private partnership and join hands with an investor in entities that are specialized in hospital management, or firms that can support the Ministry of Health in managing such a facility, so that it provides service at optimum and also quality, because you cannot ensure quality when you don't have motivated staff, when you don't have a good income to run the facility.
And speaking of the motivation for these doctors, I think currently, as you mentioned, because of the strikes and all these things, also the doctors in South Sudan generally, not only in Juba, even at the grassroots level, they are the most, underpaid public servants, if you put it that way. What are the strategies to make sure that their salaries can be, reviewed, and also their motivations and incentives can meet at least something that can?
The Ministry of Health has been doing a lot of advocacy. It's been engaging with our politicians and especially our parliamentarians. We've engaged with the Health Committee, a specialized committee on health, on several occasions, and we are been engaging with the Vice President for Service Cluster, and we're really looking forward to, and also the Ministry of Public Service. We're really looking forward to increase of the civil servant salary. The civil servant emollient need to be increased. We cannot continue to provide service to the people, expect hospital to run 24 hours when we don't pay the doctors and nurses and all the other health cadres very well. Even the cleaners, because it's a tedious job working in a hospital. Maintaining a hospital, infection control is a big challenge. So we need the hospital to be cleaned all the time, cleaners to be working round the clock. It's not an easy thing. And I think motivating staff and increasing salary of the civil servants across the board is one thing Ministry of Public Service really need to work on. And I think the Legislative Assembly has discussed that, and the Ministry of Public Service has been tasked and has put in some proposals. And I hope, and from this juncture, I really want to urge our leaders to look into this issue of increasing the salaries of civil servants, not only doctors and nurses and health professionals. It's just all the civil servants, because health and education are a priority in our country, and we really need to look into these two priorities.
And currently there is an ongoing exchange program that is initiated by the Ethiopian government to support South Sudanese doctors to pursue a residence program in Ethiopia. We happen to have visited them sometimes back early this year and seen their condition. First of all, it's a noble initiative, but there is the complaint that because according to the residence program, the Ethiopian government is to pay for their fees and all this, but South Sudan is to pay for their upkeeps, which they are complaining that is also not being met. What is the ministry and the government of South Sudan doing for these doctors who are now receiving the much needed trainings in the neighboring country to come back home and deliver these services?
Well, actually, like you said, it's a noble cause. The Ministry of Health has strived over the years to increase human resource for health and to scale up human resource for health through investing in training. It started inside the country by increasing the health science institutes across the country that will produce mid-level cadre, nurses, midwives, lab technicians, and other allied health professionals like pharmacy technicians. And this program of sending doctors to Ethiopia and Tanzania and Egypt is in a quest to improve the health service delivery and also to produce postgraduate doctors that can work in different specialties. The Ethiopian scholarship has different specialties: pediatric, gynecology, orthopedic, surgery, and all other specialties, as well as in Egypt, we have the Egyptian fellowship program. The Ministry of Health has tried its best to support them, but unfortunately, we find challenges with the Ministry of Finance. We have a lot of arrears at the Ministry of Finance. Following up claims from Ministry of Finance have been very tedious, And currently we had more than 29 students accepted on an Ethiopian scholarship, and the request has been submitted for a long time. We are not able to get the money from them, and in fact some of them had to use their own funds to travel to Ethiopia. And missing such an opportunity is not a good thing for the country. And if the neighboring countries have supported us to train our own doctors in subspecialties, at least we should meet our obligations of supporting them with this small money we're supposed to be sending them every month. So again, it is a responsibility of the Ministry of Finance to support us to meet the demands of those doctors who are doing postgraduate training in neighboring countries.
Good. And Doctor, we also would like to learn and know about the quota of the health from the national budget, and how little or how big it is to meet the requirement. But maybe before you answer that, let's have a very short break and we'll
No worries.
come back to talk about it. We're going for a short break. Stay tuned. Investors Corner is back shortly. There are plenty of investment opportunities in this world's youngest nation of South Sudan. To better understand the economy and explore the thriving market of this country, you ought to get out of your comfort zone. You either hustle under the scorching sun in Konyo Konyo market, run errands at a small or medium business enterprise, or better yet, chair a conglomerate board meeting at a high-end tower in Juba. While awaiting an official business trip to the region. Whatever you do, just don't rest. Work hard, think big, and be smart in order to count all your economic blessings through this weekly business show of the Investors Corner, exploring hidden treasures. Join us every week at this time. Welcome back. This is the Investors Corner, where we explore hidden treasures. As you've seen earlier, I am joined by the Undersecretary of the Ministry of Health, Dr. Victoria Anip Majuru. Welcome back to the program.
Thank you, Ted.
Before the break, I was asking you about the national budget and the percentage that the health sector receives. I understand it's small, even before you tell me, but what are the technocrats like yourself doing to ensure that that percentage can be increased, considering that health is one of the most important sectors in the country? Well,
the health budget over the past few years was quite low. It was less than 2%. And it was barely covering salaries and transfer to the states. But luckily, with support from our technocrats in the ministry, we've been doing a lot of advocacy. We've been advocating for increase of our budget, and our government has responded positively to that call. And I want to thank His Excellency the President for increasing the budget for health to 9.6%. It is really appreciated. It's a big jump from 2% to 9.6%, although we have not yet met the Aboye declaration of 15%. But it is appreciated, it is well received and acknowledged, and we're still hoping to have more budget to health, because health and education are a priority, like I said earlier. And for us to have good health services to our people, I mean, having a healthy population leads to economic productivity. You have a healthy population, they will contribute to the economy of the country and for prosperity of the country. So we continue to advocate with the health committee, a specialized committee on health. Luckily, in this specialized committee on health, we have at least more than 3 former ministers of health and a former Undersecretary of Health in that specialized committee. And they've been very supportive. And during this current budget engagement, we've been really engaging with them. And the chairperson has been very positive and cooperating with us. And we still to continue to work with the specialized committee on health to make sure that our demands are met. And one important big thing we're pushing with them is this issue of improving the salaries of the healthcare workers and incentivizing them to motivate them to stay on the job and to avoid the brain drain.
Yes, and still on more related issue also is the policies that are put in place maybe to attract investment in the health sector, because we are seeing in Juba, for example, most of the investment are focusing on recreation, focusing on the hotel and all this. But what are the policies that the government and the parliament need to put in place to ensure that they encourage investment in the health sector? And to have a double-barreled question also, would like to know about, you mentioned earlier that there is a need to push for opening of more health science colleges and institute, while this institute being put in place, what are the policies also that are put in place to regulate them so that they don't end up, graduating people who don't meet the standard?
Definitely. Thank you so much. With regards to the Health Science Institute, I'll start with this one. The Ministry of Health has a Directorate of Training and Professional Development, and this directorate is responsible for training mid-level cadre. They have a curriculum. They have policies and guidelines to ensure that we are graduating doctors, mid-level cadre who are practicing in facilities and who are going to contribute positively to the health sector. We are in communication with the Ministry of Higher Education. In fact, this morning I met with the DG for training, and our concern is the private health institute which are now flourishing outside there, which are not regulated. It's very important to have a regulatory framework in place to regulate the profession. And we have the nurses and midwife bill, which is still in the Ministry of Justice for a number of years, and we are hoping that the Ministry of Justice will look into it and make sure that these bills are really enacted, because the profession needs to be regulated. We have the South Sudan General Medical Council, which is regulating doctors, pharmacists, and dentists, and it is actually up and running, but it needs to be reconstituted. We've been in discussion with the Ministry of Cabinet Affairs over the past few months, and we're in the process of putting in a new council to regulate the profession. We also have the Drug and Food Control Authority, which is a parastatal linked to the health sector to regulate the drugs coming to the country, ensure there's no counterfeit drugs, and also licensing of companies, pharmaceutical companies, and make sure the pharmaceutical industry is going in line with the policies of the country. In terms of investment, I've seen a lot of investment being directed towards hotels. Now we have a lot of hotels. We have Radisson Blue coming up, Pyramids, and all other five-star hotels coming up in Juba. I've also seen recently a drift towards education, which is good. There's a lot of private schools coming up, high school and primary school, international and national. But I also want to urge our business people and investors to go towards the health sector, because investing in health not only saves lives, but also leads to economic productivity, leads to healthy populations, and contribute to increasing the economy of the country. And I think the Ministry of Investment and our legislators need to put in place policies that makes it easy for investors to come to the country and invest in health, but also being mindful of regulation, because the Medical Council is there to make sure that the doctors practicing, especially foreigners, are licensed, make sure that qualifications they come from overseas are checked, so that we don't end up having people who just come here to practice on our people and they're not necessarily having the right qualifications. So this is what I could say about the issues of investment in health, but it's a rewarding investment, and I encourage our investors to invest in health sector.
Yeah, maybe indeed, like they say, health is wealth, maybe from that line. Yes, and the ongoing fight against coronavirus, COVID-19, and other pandemics, which seems to have been overshadowed by the fight against COVID. How do you rate the fight against COVID in South Sudan by the Ministry of Health? Does it meet the standard, the expectation, or what are the shortcomings? Ministry
of Health has done its best in controlling the coronavirus pandemic, though South Sudan and many African countries are low prevalence for COVID, but we have tried our best. We have tried to work with our partners, especially WHO, the Technical Secretariat, and CDC South Sudan office, to make sure that we're adhering to the standards the world is going through. We have put in place surveillance system, and a robust surveillance system is now in place in South Sudan. The Public Health Emergency Operations Center, which was set up a few years ago, is now strengthened. There's a strong capacity in the Public Health Emergency Operations Center, and we are able to respond to any sort of epidemic. In fact, we've had a number of outbreaks of cholera, outbreaks of hepatitis E in Upper Nile, and our teams have responded to it. Recently, we have an outbreak of measles in Western Bahr Ghazal, and our surveillance officers have been really trained, and they're able to, on daily basis, give us data on surveillance and what's happening across the states, because we have county surveillance officers, state surveillance officers, and they in communication all the time, and they're linked to our surveillance team in the Public Health Emergency Operations Center. We've also recently launched a very nice program, the Field Epidemiology Training, where we train all our surveillance officers across the states for 3 months, and we give them certification. We're also expanding it to a diploma and to a master's degree, because it's through AFINET, the African wing, which is doing the field epidemiology training, and it has been up and running for many years in neighboring countries, but South Sudan have just recently launched it and have graduated the first cohort some weeks back. So these are all efforts to strengthen epidemic surveillance and response in the country, preparedness and response. Yes,
we would also like to know about the health sectors. You mentioned earlier the Kir Mayardit Women and Children Hospital in Rumbek, and the General Hospital in Kapoita. There is a hospital there. That these hospitals are major big hospitals, but they are not. They are put in a place that have low response. I mean, not in the big cities like Juba or Malakal. What do you think is going to be the fate of these very good institutions that are put in a place that does not meet?
I think those hospitals need to be strengthened, because again, it comes back to motivation of staff. Some years back, there was a strong package of retention for doctors, and Kir Mayardit Hospital has doctors. They were working there, and it's a referral hospital. So instead of flying to Khartoum, I can fly from Juba to Kir Mayardit in Rumbek. It cost me less. Coming from Wau or coming from Tonj, it's easy by land to come to Kir Mayardit and get the service. It's a specialized hospital for women. But the issue is motivation. Staff have deserted the hospital. There's no support to the hospital. There's no running costs. And that's why the hospital decided to deteriorate. So putting in place, we've recently visited the hospital with a team of donors which are supporting maternal health, and we're still engaging with those donors, and especially the Chinese government as well, to continue to support Kir Mayardit, to revitalize it and make it work again, because it's unfortunate that we are losing such a facility and it's underutilized. The hospital in Katiko, of course, has also deteriorated over the years. People are not coming there. Doctors are not motivated to stay in the hospital, and it lost its value. So these are lessons learned, and that's why when we have new hospitals like Gudeli General Hospitals, we count on those previous experiences to change the status quo and perhaps change our mindset in managing health sector, because yes, we are doing primary health care, but tertiary care cannot be free.
And also the leprosy hospital in Wau that is not in use.
Definitely.
Yeah. And yeah, because of time, we'll have to take it maybe quickly from here. We would also like to know about the cooperations between the government and health partners in health service delivery. We understand that health partners are really working closely with the Ministry of Health in its health service provision. Can you tell us about
the health partners have been working with us really good. WHO has been supporting in providing policies, guidelines, in providing the technical support to the Ministry of Health, especially with epidemics, especially with corona. And we also have CDC South Sudan. We have the World Bank. World Bank is our biggest support in vaccine deployment. They put in a lot of money for vaccine deployment to the states. And UNICEF is also supporting through the COVAX facility to ensure that there is vaccination in the country. And they're also supporting the vaccine activities across the states, because now we have integrated vaccination within routine immunization. As COVID is going to be our new normal, all the vaccination of COVID is done within the primary healthcare settings. UNICEF is on top of it, is supporting it with the API teams. And COVID has been a blessing in disguise. Because of COVID, we've benefited from a lot of donors, and we have now a proper infrastructure in place. We have a lot of equipment of gene expert machines procured by the Global Fund. We have PCR machines. The task force has also procured a number of equipments, a number of protective equipment through the support from our partners, and also through grants supporting COVID. So although COVID has become a challenge, it also became a blessing in disguise, and we are able to improve our health sector because of COVID situation.
Well, thank you very much, Dr. Victoria Anip Majur, for giving us your time. We'll have more time in the near future to talk more about health matters. But in the meantime, thank you.
Thank you.
And this brings us to the end of the Investors Corner, where we explore hidden treasures. I've been your host, Tech Stephen Ugut, wishing you a very good time.